So here we have another patient. When assessing which tip to use and what we're going to use with this patient, it's important to look at the deposits, the stain, and the depth of the pockets. When assessing, you want to feel subgingivally how deep are the pockets, how hard is the calculus, and how much bleeding. As you can see with him, we will be using our air polishing in a 3-part system, plus I'm going to choose a subgingival tip for the ultrasonics. This patient has about anywhere from 2 to 4 millimeter pockets. Light inflammation, and I can actually feel the calculus subgingivally sitting at the contact point. So, a light, easy tip that I can use subgingivally will be appropriate. I have chosen the 40H tip because of its angulation, the fineness of the tip, that I know I can use supra and subgingivally. Remember, using the tip 1 to 2 millimeters in a back and forth motion, using only the side of the tip because it's piezo. Using it as you were using a hand sickle scaler. So this is after power scaling. Now you see we finished up with our power scaling, removing as much as we possibly can remove from subgingival calculus, supragingival calculus, and stain. Next, we need to follow up with a series of hand scaling, from sickle scalers to Gracie's, depending on the amount of the deposit, the hardness of the deposit, and the depth of the pockets. Using the same movement we did as piezos, with a 1 to 2 millimeter up and down movement with light pressure. The next procedure is air polishing. We're going to choose a 3-part system. We're going to choose pearls first for stain removal and whitening effect, followed by a prophy cup for finishing and smoothing out of the surface of the tooth, and then last we'll use glycine for subgingival biofilm removal. Starting with pearls. Remember, pearls are used at a 60 to 90 degree angle towards the tooth in small circular motions. After pearls, you can see most of the stain is removed, but we still want to follow up with prophy cup hand polishing for that fine, soft, smooth effect. The last and final stage is removing your subgingival biofilm with glycine. Remember to angle the tip 45 degrees towards the sulcus and using scallop motions quickly go around the teeth. And there you have it. Start to finish, the best treatment you possibly can offer for your patients.